Good morning, everyone, or afternoon now, everyone, to the 5210 Intellectual and Developmental Disabilities Toolkit. This meeting will also be recorded and posted on the Iowa Medical website for future references as well. Before we get started, I'd like to thank Iowa SIMS for help funding the 5210 webinar series. Today's panelists, we have Dr. Gross with Iowa Chapter of American Academy of Pediatrics, Betsy Lynn with the Iowa Department of Education, and Melissa Clark-Wolf with Courage League Sports. And I'll turn it over to Dr. Gross to get started.
Well, thanks everyone for joining us today. We're excited to share with you the work that our group's been doing. I'll just start by reviewing our objectives today. One, we wanted to give you the opportunity to become familiar with the 5210 Healthy Choices Count Intellectual and Developmental Disabilities Toolkit. Secondly, we wanted you to be able to understand the healthy eating and physical activity challenges that may be faced by children with intellectual and developmental disabilities. And then I'll cover those two objectives, and I'll turn it over to Betsy, who will talk to you about how to effectively partner with schools to support healthy habit development for children with intellectual and developmental disabilities. And then finally, we'll turn it over to Melissa, and she'll give you some great information about referral sources as well as how to include kids in physical activities who may be facing challenges with intellectual and developmental disabilities. So to start with the background of the toolkit and 5210 in general, if you're not familiar, 5210 is a Healthy Choices Count. It's a campaign that's going on across Iowa, and it's kind of two parts. It's the message itself. The 5 stands for 5 servings of fruits and vegetables a day. The 2 stands for 2 hours or less of recreational screen time. The 1 stands for 1 hour of physical activity, and 0 stands for 0 sugary beverages. And this is a common childhood obesity prevention message that's used across the country, and that's been going on in Iowa here for the last year. And it's more than a message, it's also technical support and resources to make changes in our environments and the policies where children live and play and learn to make the healthiest choice the easiest choice. And so sites that are committed to supporting 5210 Healthy Choices Count work towards these 10 strategies for success. And you can see here that there are multiple sectors that 5210 works in: early childhood, workplaces, after school, schools, communities, and healthcare. All of the programming for 5210 Healthy Choices Count is based on a program out of Maine called 5210 Let's Go. It's been in existence for 10 years, or 12 years now out there, and has some really great research showing the beneficial effects of this on the childhood obesity rates and the health of the citizens in Maine. And so the strategies include all these listed on the screen, and all of these things contribute to making healthy choices easier for kids no matter where they're at. So we at the Iowa chapter of the American Academy of Pediatrics, we have a committee on obesity, and our group applied to receive a grant from the national organization of the American Academy of Pediatrics that focuses on childhood obesity prevention and healthy habits. And we were awarded this grant. The focus of the grant was to support healthy weight for children with intellectual disabilities. And this grant opportunity was sponsored with support from the Special Olympics. We also, throughout this work, have had great support from folks in our state, including the Iowa Medical Society, United Way of Central Iowa, and the Healthiest State Initiative, as well as all of our stakeholders that were involved in our group. So our project included these goals. Our goal was to include children with intellectual and developmental disabilities with the 5210 Healthy Choices Count campaign that's going on in our state. And to do this, we wanted to build collaborative relationships between community partners and healthcare providers to more effectively address the needs of the intellectual and developmental disability community. We convened stakeholders across multiple sectors to adapt the Let's Go Intellectual and Developmental Disabilities Toolkit, which was developed in Maine. And we wanted to make sure that it was able to be applicable to us in Iowa. And then we also developed a one-page handout for statewide healthy eating and active living resources for the population with intellectual and developmental disabilities, and that will be distributed with our toolkit. So our group started to meet in April, and we concluded our work here at the end of November, and so we wanted to share the results of that. So this is a picture of our 5210 IDD Toolkit revision team, and we've listed all of the stakeholders who were involved in this work, and I want to thank them for all of the time and dedication that they had to this project. So this is the picture of the toolkit itself. So it's very similar to what Maine developed, and we just made a few adaptations in some of the information that pertain to the Iowa education system. And so we hope that you'll be able to get a chance to download the toolkit and check it out and see which parts of it you would be able to use in your line of work. So there's 5 different sectors. One is kind of an introduction with some background information, as well as a sector on promoting healthy eating and physical activity, as well as the importance of non-food rewards, as well as information for healthcare providers on how we can help partner with schools to help these children. This is just an information card that we've developed to promote the toolkit, and at the bottom you can see that there's the link for the website, the Childhood Obesity Resource page at the Iowa Medical Society. If you click on that, you'll be able to see 5210 IDD Toolkit, and you click on that and you've got the PDF of the entire toolkit. You're free to print that and distribute that to anyone who might be able to benefit from that information. This is a screenshot of our resource page. It's a front and back one-page resource page with great information about the folks in our state that can help patients affected by intellectual and developmental disabilities. And so Melissa's going to go through some of the information about these partners. And then finally, this is a screenshot of the website. Again, the URL is at the bottom, and you can see on the left-hand side of the screen, it's kind of small print, but you'll see 5210 IDD Toolkit. You click on that, and that'll take you to the document. And then finally, we also integrated the components of the toolkit into the various sectors information. So that's all right there on the Healthy State Initiative website. So if you're looking for information for healthy eating, you'll find that general information as well as some specific information that might be helpful for kids with unique challenges. So let's talk a little bit more about our second objective, understanding healthy eating and physical activity, challenges that might be faced by children with intellectual and developmental disabilities. I'll start by just talking a little bit about obesity in general. We know that it's a really complex disease condition mediated by a lot of different factors, and it is the most prevalent chronic disease of childhood, affecting about 12.7 million children in our country. That's twice the rates of children affected by asthma. In our state alone, about 2/3 of adults are affected by overweight and obesity. About 1/3 of those are affected by obesity. That ranks us 4th in the nation as far as obesity rates in our state. As far as the youth in our state, about 1/3 of the children that walk into our clinics every day are affected by overweight and obesity. About 17% of our youth have obesity. That's about 10th in the nation. And interesting that children, obesity and disabilities, it's the correlation that obesity rates for children with disabilities are actually 38% higher than for children without disabilities. And this is information from the CDC. You can see that children with disabilities, about 22% of those children ages 2 to 17 are affected by obesity in relation to the about 16% rate looking nationwide on children without disabilities. And so what are some of the challenges facing people with disabilities that might contribute to this disparity? There sometimes can be a lack of healthy food choices, and this is disabilities in general, physical and intellectual. Difficulty with chewing or swallowing foods, its taste or its texture. Medications can contribute as well. There may be physical limitations that reduce a person's ability to exercise. Pain may be a factor, a lack of energy. Additionally, a lack of accessible environments can play a big role, and a lack of resources necessary to incorporate healthy habits into their lifestyle. With regard to healthy eating, there can be challenges as well, in particular for children with intellectual and developmental disabilities. They could have oral motor problems. They may have fewer caloric needs due to decreased mobility. Food can be used as a reward in many settings to modify behavior, and that may expose children to additional calories. As well as mealtime behavior can be challenging for some children. And also there may be a lack of self-awareness for eating as well for some of the children. Moving on to physical activity and challenges, there can be functional limitations. Inclusivity and some opportunities for physical activity can be an issue. Sometimes attitudes towards physical activity can be different in this population. There can also be some safety concerns that we need to take into consideration. And so, furthermore, in healthcare, there are challenges for children affected by IDD as well. There can be disparities in care. Sometimes these children may not be receiving healthy habit counseling as much as they're typically developing peers. There may be barriers to care. Providers may not have training about the specific resources that might be beneficial for these kids and might not have experience, and that's what this webinar is meant to address and to provide some of that training to make folks more aware of what opportunities there are for patients out there. Thirdly, medications can interfere with appetite and metabolism and can be a challenge as well. And there can be problems with lack of training of healthcare providers as well as those folks that are helping these children in the community. They may not receive training on how to help these children with healthy eating and active living behaviors. And then finally, there are multiple services and transitions, and so it can be difficult to coordinate all of the folks who touch these children's lives throughout the course of the day, and consistent messages between all of these individuals who are helping these children and consistent strategies can be really important to be able to promote behavior changes towards healthier eating and active living across all the different settings. So what can we do as healthcare providers to support healthy patients or healthy habits in all of our patients? Kids, when we're talking about the children with intellectual and developmental disabilities, their needs may be different. They may have different needs related to their different diagnoses. And we know that no single provider is expected to address all of these needs, but we should be able to be familiar with what services are available and be able to connect families with the professionals who might be able to make an impact on the challenges these children are facing. So in regard to healthy eating referrals, these are some of the challenges that your patients may be facing and some of the potential referrals that we can think about. There are lots of occupational therapists and speech therapists available across our state who can help address some of the issues with sensitivity to food, taste, and textures and selective eating, as well as our partners, the registered dietitians across the state can help as well. Sometimes there are low muscle tone around the mouth issues that the therapist can address, as well as the influence of poor posturing as well. And then sometimes some of the behavior specialists in our state can help children with some more challenging behaviors about seeking unhealthy snacks throughout the day and challenging mealtime behaviors as well. In regard to physical activity, there are lots of partners that we can refer to as well. We can partner more closely with the physical education specialists in the schools, as well as the physical therapists available at our community children's hospitals or community hospitals, as well as through AEA or recreational therapists in our communities. Sometimes there are difficulty understanding the rules of the game, so there's adaptations that can be made, and Melissa will talk about some of these social skill deficits that may prevent involvement in group games, and so we can support children in the development of some of these social skills by helping them, connecting them with speech therapy or social workers that have specialties in this area. Difficulty finding inclusive after-school programming, and Melissa will give us some great resources for that, which is really exciting. Sometimes kids are overstimulated or tire easily, and so making some adaptations with their PE teacher or working with an occupational therapist to build some of that strength and endurance can be helpful, as well as some other concerns about exaggerated fear of injury during physical activity or not meeting daily requirements. Again, if we can get our physical educator and the schools some resources to help with that, or we may be able to partner with recreational therapists or social workers who are working with that child throughout the course of the day as well. So I'm going to turn it over to Betsy. She's going to talk to us more about how to effectively partner with schools to support healthy habit development for children with intellectual and developmental disabilities. Betsy?
Hi, can you hear me okay?
I can hear you just fine. Thanks.
Great. Okay, so my name's Betsy Lynn, and I work for the Iowa Department of Education. My role is primarily in early childhood special education, but I do work around special education, birth through 21 as well. So I was happy to serve on the group that worked on this toolkit, and I'm just going to share some pieces out of the toolkit that really touch on how partnering with schools and how to do that in various different ways. So go ahead and go to the next slide. And so in the toolkit, we start with several definitions because, as I'm sure you are all aware, all of us have our own jargon or terms that we use within our field, and of course the definitions of those terms might be a little bit different depending on who you're talking to. And so in education, you'll see two definitions there for intellectual disability and developmental disability, which I think are important, but I want to highlight the third definition there, which is really where the realm of school kind of uses is the eligible individual. So when we are talking about special education services in schools, we are referring to those students as eligible individuals. In Iowa, we're kind of unique in that we are a non-categorical state when it comes to special education services, which means that a child does not have to have a specific disability label in order to receive these services. We just say they are eligible. And so it's a little bit different than in other states where you'll see children have a certain disability label, like intellectual disability, developmental disability, maybe autism spectrum disorder. There's various ones, but in Iowa, we refer to them as an eligible individual. Go ahead. And so there are various types of services and plans that are available that could help support some of these habits that we're talking about around healthy eating and physical activity. One that Jennifer kind of referred to was a behavior intervention plan. So that is a plan that is written, could be by a psychologist or a BCBA or other certified professional, and it really focuses on those challenging behaviors and how a team can help address those behaviors and, most importantly, teach the child some replacement behaviors that are more appropriate. And so that type of plan usually is attached to an IEP, which I will talk about in a little bit. So you will commonly see behavior intervention plans in schools for children who need them. The second term on here is early access, and so this term is referring to the services that are provided to infants and toddlers with disabilities. So this is for young children ages birth until they turn 3, and early access is a little bit different than our special education services that are provided in a district, in that early access or early intervention services really are coming through various different organizations. There's a partnership between the Department of Ed, Public Health, Human Services, and the Child Health Specialty Clinics, as well as some other community partners who all come together to provide those services. So from the age of birth till a child turns 3, if they are eligible for some early intervention services, they're coming from all of these different providers, not from the school district per se. But it's important to know that there are services available to infants and toddlers with disabilities or who may be at risk for developing a disability. They have their own eligibility criteria, so it's also a little bit different than how we determine if a student's eligible. Early access has their own criteria, but those services are available and important for everyone to know as a place to refer if there are some issues around physical or with the healthy eating services that might be needed. Go ahead. So an IEP, or Individualized Education Program, is what is written and created when a child or student is eligible for special education, so ages from 3 until 21. And basically the IEP is going to spell out all of the goals and services that this child needs based on their disability. The IEP is written and reviewed at least once a year. They can change it more often if needed. And every 3 years, they need to do a reevaluation to decide if the child is still eligible for special education services. So the IEP is where you're going to find a description of what are the goals that this child needs, what are the services and supports. It's very specific to the child, and it's always based on the child's disability, their needs. And it's also important to know that the IEP is written by a team of professionals and family members. It's not written by one person. There's actually guidance and law around who should be involved, but always the family members, and then various people from the districts and AEAs also contribute to writing this IEP. And I'll refer to that IEP throughout the next few slides. The 504 plan is a different type of plan where if a child has a disability, but they are not eligible for special education services, but they still may need some types of accommodations or different types of services, but not eligible for special education, they may have a 504 plan, so a different kind of plan, but still related to a child with disabilities. Okay, next slide, please. Okay, an IFSP, or an Individualized Family Service Plan, is what a child receives when they are in those early access services. So from birth until they turn 3, if they are eligible for early intervention, as I talked about earlier, then they would have an IFSP. And again, it's similar to an IEP in that it's a plan that shows the services and the outcomes that the team has determined for that child based on the child's needs. And so an IFSP and an IEP are very similar. The difference is just the age. IFSPs are for birth until the child turns 3, and once they turn 3, they move over to an IEP. And then an individualized health plan is another type of plan that is usually can be attached to an IFSP or an IEP, and it's specific to health service needs. And so it's usually written in conjunction with a school nurse or other medical professional that just talks about if there are some specific special health services or needs that a child might need to have spelled out within an individualized health plan. Again, licensed health personnel help develop this plan in collaboration with the parents or families as well as the team that's writing the IEP. They need to keep that updated, and hopefully at least annually they're reviewing that when they're reviewing the IEP as well. Next slide. And so special education, when we talk about special education, it's defined in the Individuals with Disabilities Education Act. That's the federal law. IDEA is what we often call it for short. And what we mean by special education is that we're saying that a child is eligible for specially designed instruction at no cost to parents. And it's all about meeting their unique needs, including instruction, conducted in the classroom, and home, and hospitals, institutions, other settings, and also specifically calls out instruction in physical education. And then another term that we often use is transition services. And so once a child turns 14, it's important that teams are thinking about transition. What is going to happen once the child graduates from high school and moves on? And so transition services, they start talking about those again as the child is turning 14 and continues on until they exit out of the program. And so we'll talk a little bit about those coming up as well. Next slide. And so on this slide and in the toolkit, there is some information about how to use these different plans and services that I just talked about to help support those healthy habit goals. And so within the IFSP, IEP, and the IHP, so those individualized plans, again, they always contain goals, services, and accommodations that the child needs. And it's always based on the child's disability, and it's in order to ensure a free and appropriate public education, or what we call FAPE. That is the purpose of special education services, is to ensure the child is receiving that free, appropriate public education. And so annually, teams get together to assess the child's needs and create those plans. And it is possible that those plans may include goals related to healthy eating and physical activity, as long as that those goals have to do with ensuring that free and appropriate public education and are related to the child's disability. Next slide. So these are just some guiding questions that come out of the toolkit to help teams think about, is it appropriate to include maybe some services or goals around healthy eating and physical activity? And I'll just point out a few of them that Jennifer referred to as well, around things like difficulty chewing or swallowing, maybe something that could be included as an occupational therapist support service within an IEP. Physical activity, again, it's called out in our federal law to make sure children with disabilities are having access to physical education. And so what are some of the things that the team needs to think about to ensure that those supports are being provided? So just some nice guiding questions there for teams to discuss and consider when writing those plans. Next slide. We always give the guidance that goals that are written within these plans have to be both measurable and attainable. There are some great resources in the toolkit around using non-food rewards as a strategy. Often that's something we typically see when looking at challenging behaviors, especially, is that teams want to use food as a reward. And so as part of this initiative, we really want to try to steer away from that. And so there are some really good strategies within the toolkit about how to try to consider other types of rewards to help reinforce those desirable behaviors. And then writing these into the plans, again, healthcare providers are always encouraged to provide recommendations or guidance to the family and to the IEP team, and especially when there is written documentation or information about what is the child's medical diagnosis and how might that medical diagnosis be impacting nutrition or physical activity. What are some of the things that medical professionals might suggest as goals? And those always are considered by teams when they are writing their individualized education program or their IFSP, their family service plans. The teams are always considering all information that is available about the child. And so it's important that that's included when the team is discussing these plans. Okay, next slide. Then once we go into transition plans and we're talking about an eligible individual who's turning 14, the IEP needs to start thinking about what are those supports to help the child when they get ready to transition out of those services. And again, we're looking at the needs based on the individual's disability. And so there are different types of services that could be provided, and really the team looks at a comprehensive transition plan that helps ease that transition from high school into adult life. And so there may be things that could be included in that plan around ensuring that the student's ready to lead a healthy, independent life after high school. So things around healthy eating and physical activity could be part of that transition plan if needed and determined by that team. Okay, next slide. So again, in the toolkit, there are some great resources and guiding questions that would help with those transition plans and how healthy habits might be incorporated in there. And so you can see some various questions, again, that the team might want to discuss or consider as they're thinking about those transition plans. And again, the transition plans start at age 14, but they continue to be discussed at every IEP after that. And so it's not a one-time thing. It's an ongoing process to make sure that the right supports are in place as the child is getting older and ready for that big transition into adulthood. So just some great questions there that you can see that might help the team land on some services or goals around transition. Next slide. And so this is a great slide that shows it really is a team effort. It's not one person. And so this shows how everyone really does play a role in making sure that a child's plan and services and supports are really going to meet their needs. So of course the educator, and there's different roles depending on the age of the child and the needs that they have, but one role might be that the educator is helping the student make sure they have a basic understanding of proper nutrition. And again, addressing those healthy habit goals as needed in the transition plan. PE teachers or physical education teachers are one of the biggest supporters in those physical activity types of supports needed. Speech and language pathologists, social workers can help them think about social skills needed to access community resources. Again, healthcare providers can help suggest or work with the student on setting those personal healthy habit goals. Occupational therapists working on those fine motor skills that might be needed in things like cooking or feeding. Case managers are often very helpful in aligning all of the different resources that are out there. That's always a huge challenge for families to understand what are the different resources that are available, who provides them, and how do they access them. So often case managers help with that. And then, of course, families have a big role in modeling those healthy habits and identifying ways for their child to become more independent. Next slide. So the legal requirements, I'm not going to go into a lot of detail around this, but there are 3 major laws. There's even more than that, actually, but this one highlights 3 of them that really do govern the inclusion of children with disabilities, especially in physical activity. So again, Section 504, that's what I refer to as the 504 plan. For those children who may have a disability but are not eligible for special education services, those 504 plans are important to them because they may still need some accommodations in school, and so that's what helps lay those out. There's a Dear Colleague letter in 2013 that comes from us from the Office of Civil Rights that discusses physical activity and in making sure that children with disabilities are included. And then obviously our IDEA Act, our Individuals with Disabilities Education Act, which again governs special education services. Next slide. So there it just tells you a little bit more information about Section 504 and how it really is there to protect the rights of individuals with disabilities, especially when they are not eligible for special education services. And so ensuring they're provided with physical education and that they have the same opportunities to engage in extracurricular athletic activities as well. Next slide. And then here is some more information about that Dear Colleague letter that I was referring to, where it talks about ensuring that students with disabilities have the same opportunities to be physically active as their non-disabled peers. And so working to ensure that those students have access to participate in things like athletics, that they're not excluded because of their disability, that they have an equal opportunity to be part of different sports teams or other types of extracurricular activities. and making sure that they understand that that they have to think about the individual need and not making generalizations about what one student's capable of based on a type of disability they might have. And then obviously making those reasonable accommodations to ensure that equal opportunity. So it's a nice letter that really talks specifically about how we ensure students with disabilities have those same opportunities to be physically active with their non-disabled peers. Next slide. And then the IDEA, again, is that federal law, and that requires schools to serve the educational needs of students with disabilities. So making sure they have that free and appropriate public education in a least restrictive environment, and that PE or physical education is part of that. It is required for all students, especially those who receive special education. When we talk about least restrictive environment, that's another one of those kind of jargon or terms that we use in education. And basically what is that saying is we want students to be part of the school environment, part of the classes, part of everything that their typical developing peers are part of, and not removing them from those opportunities unless absolutely necessary. And so least restrictive environment means making sure the student has access to the general education environment, and we provide the supports there. And then if we have to remove them, that we have data that shows that's needed. But as much as possible, keeping students with disabilities in those same opportunities, classroom settings, those extracurricular, all of those, the same opportunities that their general education peers have as well. Next slide. And so in partnering with school teams to support those healthy eating and active living types of supports, again, you can see that those plans are referred to, that IFSP, the IEP, an individualized treatment plan that's referred there typically is more around support services that might not be provided by the school but by other community providers. And then obviously the individualized health plan also. So again, there's goals, there's services, accommodations that are all included in those plans. They must be based on need as a result of the child's disability. And I just point that out because we all have goals for all children to have healthy eating and positive physical activity. But what's included in these types of plans are specific to that child's disability and decided by the team. And so how a healthcare provider can play an important role in that, again, is by contributing information that's helpful to the team when they're thinking about those goals. So helping provide any information about if the child does have a medical diagnosis or a medical condition that might be impacting their healthy eating or physical activity, that's spelled out and provided to the team as information to consider. But also just reminding families that recommendations provided by anybody outside of the team, whether it's a healthcare provider or a community provider or support service provider, those are always just recommendations. They're not necessarily required for the team to adopt. And so just want to point that out, that sometimes families think that if a healthcare provider makes a recommendation for a certain type of service or a certain type of goal, that the team has to put that in the IEP. And that's just not the case. The case is that the team has to consider that information, and it should be part of their discussion around what is included in the IEP, but it's not required for the team to adopt that. So just helping families understand that the information that you might be providing as a healthcare provider is important information for the team to look at and discuss, but not required for them to adopt. Next slide. Oh, there we go. So here are just some things around what health providers can do. So again, recommending some of those goals that might be identified. Other goals around healthy eating, non-food rewards, physical activity, screen time, sugary drinks might be added. Those might be included more in things like a health plan, especially the ones around what they're eating. Using those education and service plans to support those goals. There is a handout in the toolkit that is helpful if you're looking for a way on how to make those recommendations. I think we're going to show a screenshot of that coming up. And then again, once the child turns 14 or is approaching that age of 14, thinking about how transition plans could help support those habits for teens and young adults. And especially talking to the patients about those. When they're 14, they are starting to become advocates for themselves, and we really encourage them to be attending their IEP meetings and being an active voice in what's included in the IEP. So I like how that last bullet refers to talking to the patients themselves, to those teens and young adults who have the disability, how they can advocate for what they need. Next slide. And why it's important that these healthy eating and physical activity goals are recommended. Again, you as healthcare providers have a lot of information that is going to be very useful to the team, and you are trusted and respected by the families, and so your advice will go a long way. Once things are included in these types of service plans, they are legal documents, and so the professionals who are working with those children are going to be held to those plans and making sure they are working on those goals as outlined. And again, the nice thing about these types of plans is that they are tracked. Progress is monitored on a regular basis, and so if there are goals in there, there is data being collected and ensured that the student or child is making progress on those goals. Next slide. Again, so how can you help make those recommendations? As I stated, there is a form in the toolkit that you could use if you're looking for some guidance or a way to provide those written statements. You could always attend meetings with the team whenever possible. Of course, that's always hard with everybody's busy schedules, but if a family felt that it's important for a healthcare provider or other type of community service provider to attend the meeting, a family is always allowed to invite whoever they want to those meetings. That will be helpful in determining what is included in those different types of plans. And then again, just building those relationships. So if you live in a place where you know the district well or the different providers, having that relationship with them and helping play that active role in developing those plans. Next slide. And yeah, so here is that screenshot of what that statement suggestion looks like. So again, just an idea of what you might provide as information that would be helpful to a team as they're writing out the different plans. And next slide. Yep, I think that's it for me. So hopefully that was some good information as you think about supporting children in education and how to partner with schools and providers in that way. So we're going to move on to Objective 4.
Thanks so much, Betsy, for your insight. It's really been great to partner with the Department of Education to be able to compare the perspectives and making sure we understand the terminology. So I appreciate your time and help with that. Let's turn it over to Melissa. She's going to talk to us a little bit more about referral resources as well as physical activity and how we can make adaptations to be inclusive of all kids.
Good afternoon, everybody, and thank you. I'm Melissa Clark-Worf, and I'm the founder, executive director of Courage League Sports, which is an adaptive recreation facility serving kids and adults with special needs in the greater Des Moines area and in Iowa City. So we're just going to kind of review these slides and talk about ways to make your physical activity inclusive and the importance of that, of including those kiddos in it. The big thing is overcoming the barriers for those kids to be active, and most of those barriers come within themselves and from their parents. So really talking with them and talking about objectives and goals, what will work rather than what will not work with them, and then adapting the play to kind of coincide with that. You know, and play comes with just changing the pace, the style of what you're doing with the activities, setting up zones and stations to do different activities with them, having a structured recess or a peer physical education program, a structured recess program where there's set activities. for them to go be active in and be successful in. Part of this is also part of the Let Us Play principles, which is part of the documents you will receive on the website. Really, the Let Us Play program is an easy-to-use set of techniques to maximize the amount of physical activities for all kids get while playing games. So they're removing the lines, eliminating elimination, reducing team size, and getting uninvolved staff and kids involved, and be creative with your space, equipment, and rules. Next slide. Some other ways to adapt some different activity or to adapt the activities is really to demonstrate. Our concept is first show, then do, and really showing them clear instructions and providing clear instructions of how to do the activities, what the end goal is, and the steps to get there. Using visual aids are also very helpful. An example would be using like an iPad and doing some pictures, set pictures that you have of the activity and show the process of the activity through those visual aids. Change the rules of the games and make them simpler. 1 to 2 tasks of those games seem to be a much easier way to follow the rules of the game. And then instead of competition, really working on that cooperation with the game of instead of, who's going to get done first, we're all going to get this done together, and changing those things. Instead of who's scoring what kind of basketball, if they're shooting baskets, it's a collective score of shots rather than his and hers or Johnny and Joey's scores. I think one of the biggest things that we probably underestimate is the social inclusion piece of physical activity. It's something that we have seen with our activities and the things that we do with our programs is once kids feel positive about what they can do, they're going to be more active in what they're doing. So really, having people who are involved with teaching the classes or running the programs is really leaving their egos at the door and getting involved with the activities and being positive role models, being clear with what the goals are, and really build up the kids and what they can do. And really, over and over, these kids have been told for a long time all the things they can't do, and they need to be told what they can do. And this has been reflected in building their social and emotional support systems that equal to better physical activity. And the other thing is that peer resource. They just want to be like anybody else in the room, in their classroom, being active with them. And identifying peers as a resource is huge because then they are right there, they have a friendship that's started, and then that peer is going to help guide them through the, and make them feel better about things as well. Overcoming, again, just some barriers, just keep in contact is a lot of behavior management on there. That's one of the biggest challenges probably is the different behaviors and working with that. Again, working with the kids and having them involved with what the activity is going to be, what the expectations are, kind of the shoulds of the games or the activities that you're going to do instead of what we're not going to do, and really turning that into a positive spin. To make all this work is a coordinated effort and making sure that everybody that's on that team is involved with this and making sure that their physical activity and movement is happening, as well as resources to get to them as well. So that includes, the PE teachers, your speech and language pathologists, special ed teachers, healthcare providers, case managers. And case managers are probably one of the biggest resources available because they're really trying to stay up tune of what's going on in your communities and what's available around there as well. And then we have just a listing of resources that we've included with this. There's Courage League Sports, and Courage League serves the greater Des Moines area right now, and also the Iowa City area. Courage League will be expanding this spring into some park and rec programs, so there'll be some more information coming out on that. Gigi's Playhouse, another great resource located in Cedar Rapids, Des Moines, Quad Cities, and Sioux City, does programming. A lot of it is for those affected with Downs, but they do offer programs for those that are not affected by Downs as well, and has some great social outlets as well. Look, Cook, and Eat is a program that is available, and it's kind of an online how-to demonstrated cooking program. Sue Haas does that here locally, but has seen great success with that as far as working with those that are affected, whether through selection, outdoor noise there, sorry. But anyways, they do some cooking demonstrations online, working with not only physical or cognitive disabilities, even has a webinar on doing something with only one hand. So another great resource for healthy cooking and habits. Special Olympics Iowa, throughout the state of Iowa, there's programs and opportunities for kids ages 8 and on up. They have play days for those kids under 8 available throughout the state, probably 5 or 6 times a year. And then they have their different Olympic events throughout the year that you can be involved with. And you can develop teams within your own community, through the schools. And so there's a lot of different ways to become a part of that as well. Other additional resources is the Ask Resource Center. So that is a center located here in the Des Moines area, but serves statewide as well. They have all sorts of different resources, from IEPs to 504s to guardianship to summer camp listings. So I know every spring they put out a summer camp guide for activities during the summer, and then over school breaks and different things like that. And that's a constant online resource that you can just look for those ideas and things like that. Child Health Specialty Clinic is a nutrition-based system to work on different nutrition goals and with dietitians as well. And then there's Blank Children's Hospital available. They also have nutritionists on staff and therapy tube services as well. And then Child Serve, similar, with therapy services available, physical medicine and rehab. They have an autism program as well, and so a wide variety of services from both of those resources. I think that concludes our end of this. So back to you, Dr. Grove.
Sounds great. Well, thanks so much for joining us today, Melissa. Just to review, I hope you've had a chance to kind of see the types of information that are included with the Intellectual and Developmental Disabilities Toolkit. We encourage you to download that toolkit, take a look at it, and utilize the sections of it that you find most helpful. Hopefully you understand the challenges that face children with intellectual and developmental disabilities around their increased risk of obesity, as well as challenges in healthy eating and physical activity, and have learned more information about how we can effectively partner with schools to support these children, and learn some information about the terminology and how best we can do that. And then finally, thank you so much for telling us about the important components of adapting physical activity to be more inclusive, as well as the great resources that are available across our state. Again, I'll end. There's the promotion for the toolkit, as well as the link to access that at the Iowa Medical Society website, Childhood Obesity Resource page. And finally, I want to end by thanking all the individuals in this photo and others that were involved but not in the photo. It was really a great opportunity for us to partner across many sectors to be able to improve the health of all children in our state. And so appreciate everyone's time in these efforts. And if you're interested in learning more, please contact me. Becca here at Iowa Medical Society can put you in contact with me, and we can get you more information. And we'll take any questions that you have. You can enter those in the chat box here, and we'd be happy to answer any questions in the last few minutes that we have. Can we get a copy of the presentation? This presentation will actually be posted on the Iowa Medical Society webpage, that same link I gave you where the toolkit will be. In the middle section, it's listed all the webinars that we've done, and that will be included as one of those webinars. And we'd be happy, and you're able to download that as well. If you send us an email, if you need a copy of the slides, I'm happy to share those. Email us here at Iowa Medical Society or get a hold of Becca, and we can send you a link to it on a Google site as well. Any other questions? Thank you so much for your time, and we appreciate your interest in this topic. Have a great day.